All they want to do is lie. Boomers' first instinct is to lie. They don't care about the truth. They just care about getting the job done. And it's disgusting. I had a manager one time that literally got his bachelor's, got his master's degree just to get into management. And as soon as the manager that was in the position left, he swept right in and got the position. Now, this guy had an ego, wasn't very friendly, had a history as being a womanizer, and just was not really management material. He really wasn't good at his job. And this was at a community hospital where, I'm sorry, but you don't get that much experience at a community hospital. Even somebody who hasn't even been in the medical field can understand this. But a lot of people in the medical field and in, I'm sure, other fields don't understand what real experience is. And at this particular hospital, their biggest thing was years of experience, which in my experience doesn't mean anything. I remember when I was a new grad and I was at one of the biggest, most well-known hospitals in the world, and it was a very tough hospital. It was extremely busy. I tell people I gauge the amount of work I do by how many times I have to change my clothes due to them being soaked and drenched in sweat. And so I learned a lot, and it was an all-around very intense hospital. It was short-staffed, and it was very traumatic. We were a burn center, we were a huge trauma center, multiple different specialized ICUs. It was, I call it the war zone, and that's literally what it was. I mean, we got mass casualty events, explosion victims, shrapnel victims, and you wonder how does that happen in an urban, city? Well, things explode, not just on the battlefield, and anything that explodes can cause shrapnel injuries and burns. And not to mention the shootings, the stabbings. I mean, it was very intense. So I started off in a hospital like that, and I learned a lot. And that's what I wanted. I wanted to learn at the worst possible environment so that I'd be capable in any environment thereafter. So after I worked there for a few years, I decided to work my way out to a smaller hospital. And when I arrived, I couldn't believe how this hospital was run, and just how the lack of experience there was at this hospital. It was just incredible. And I think that's what you get at these community hospitals, because not too many people in these rinky-dink hospitals get experience in the larger hospitals. And the people that work at these community hospitals are usually, they tend to be the lazy ones. And I think the reason because of that is when they get out of school, they don't want to go to a tough, difficult hospital to work at. They want to go to an easy, hospital that they don't really have to use their brain as much. So you end up with a cluster of these incapable, incompetent healthcare professionals. So when you get there and you come there from a very prestigious hospital and you have a very impeccable record, in school, I was top of my class, nearly a 4.0, very close. I had a 3.98 GPA, and coming in to a smaller hospital, it intimidates a lot of people at the new hospital, especially at a community hospital. So I had to deal with so much riffraff of just personalities. I was mostly just trying to help the hospital. My goal was to actually bring my experience to a community hospital because I felt that they needed help. And I had a lot of experience with not just adults, but pediatrics, infants. I was at the hospital I originated at. I was their number one pediatric specialty. Okay, I'm not going to say exactly what my specialty is, but I was their number one in pediatrics, trauma, all different types of critical situations. So, when I got to this community hospital, they didn't even know how to do basic fundamentals with pediatrics, which, understandable. It's a difficult field. In order to get the experience, you got to go to a hospital that has the experience, and I had that. But you're kind of going up against the wall because when you're at these community hospitals, nobody has experience. So when you bring experience, nobody knows if it's accurate or not. They've never been where you've been. So you get a lot of pushback. And instead of people just looking at, okay, wow, he's very credible. He worked at this, very prestigious hospital. They're known for pediatrics. Maybe we should adopt some of the things that he says. Instead, they want to go against the grain and try to formulate this perspective that I don't know what I'm talking about, that I don't know what I'm doing, that I'm just being difficult, that I'm criticizing their hospital and how they do things. But the way they were doing things was endangering people's lives. And a lot of these people have been there for 30 years, however many years, and most of them had no idea what they were doing. I call it backyard medicine, all right? Because that's exactly what they were doing. There was no studies based off of most of the stuff they were doing. Even their contact precautions and their droplet precautions, they had them backwards. They weren't even using the right PPE to treat just basic, RSV or what have you. So it was very challenging working with these people. And a lot of the people that I worked with were just trashy. I mean, most of them were all on drugs. There was one lady who was, she was probably about 55 years old and had tantrums like a 5-year-old, okay? And you can't have a functional department with people like this. And, everybody had problems with this lady. I remember one time there was some kind of dirty equipment little bin that you put dirty stuff, and it was left on a counter or something, all right? And she comes rolling in the department break room like a freight train and takes the dirty little container and slams it on the table and is like, "This is not where it's supposed to go. I found this on the counter in the ICU. This is supposed to be in the soiled utility." And then screaming at the top of her lungs, shaking her head like she's about to strangle something. And everybody's just like, what the heck? And this was right during shift change. So you got day shift and night shift here. And then I'm just kind of sitting there like, whoa. Like, I've never seen a workplace like that before. And to mention, she's complaining about a dirty container that's supposed to be in a dirty designated area of the hospital, and she brings it into a break room where people eat and slams it on the counter like she's doing like a haymaker or something. And everybody just kind of looked at her and then just kind of kept doing what they were doing, like it was normal behavior. And so I'll get to more stories about this lady, but that was one little snippet of her anger issues, and it was well known. But the company never wanted to get rid of her because, for one, they always said, well, she's been here for 30 years. And I'm like, it doesn't matter how long somebody's been at your facility. Somebody like that, especially on night shift, when you're kind of acting like she's some kind of leadership position and a senior employee, it doesn't matter. That culture is toxic, and good people won't tolerate that kind of behavior, and they'll leave. So you have this lady, crazy lady, and then you got the manager. So the manager, like I was saying, he got the position. You know, all you really need nowadays is to get a master's degree or even a bachelor's degree, and it doesn't matter anything else. And he was, you know, I never worked with him as a regular employee, but from what I could hear was he was very lazy. He was, you know, womanizer, all this stuff. But from my perspective as a manager, again, a lot of the policies that he had weren't that great, and I brought some things up to him about, I told him, I was like, you know, I really think we should use this type of tape when we secure airways. I was like, when I worked in trauma at a very critical facility, you know, this was great for when people's faces were blown off, or if they had 100% burn all over their face. It's important for this type of securement because it won't fall off. And these other ways that we're using it, you won't be able to secure it. And in that situation, this is the only way that you can secure the airway. And so he denied my my thought, you know, my securement idea, because he said it wasn't useful because they wouldn't use that. They don't have that many scenarios like that. And I said, it doesn't matter if you don't have that many scenarios. It's when you have a scenario like that, it's all about being prepared. And if you train everybody to be ready for that kind of scenario, then when it comes up, they're qualified and they feel comfortable and they know what to do. And I also mentioned, I was like, this type of issue can happen anywhere. I was like, anybody's face can get blown off anywhere. It doesn't matter if you're in inner city or out in the country. It doesn't matter. And it's more experience for your staff. So, you know, that's just kind of how it was. And, you know, it's annoying because, you know, in healthcare, the most important thing is being proactive, okay? Being proactive is the most important factor of healthcare. Preventing issues from happening can make your job so much easier, and it's so much safer for the patients. That's why I can't stand boomers. because most boomers are the, oh, it'll never happen type. Oh, I've never seen that in my career, so it doesn't matter. Oh, that's never happened before. Anything can happen, and if you have luck like me, it'll happen multiple times. And so this guy, one night he came in, I wasn't working, but it was all females that were on that shift, and he walked in just randomly and said, "What were you guys doing?" Pretty much in other words, but he said a bad word. He said, "What have you guys been doing? Playing with yourselves all night?" And of course, all the women were completely could not believe that this guy said that. And of course, people reported it, but nothing happened. Nobody cared. Nobody believed it. And I remember, I heard about it and I was furious. I couldn't believe he would say that. But apparently I heard that he felt like, this was night shift, and he felt like night shift was lazy or whatever. Okay, people have that opinion, but at this hospital, the way it was organized, you did way more work on night shift than day shift. And a lot of that organization was his fault. It's the busy work mentality with these boomers. They want everything equal. They want everybody doing the same amount of work on paper, right? They feel like it should be exactly the same. But what they don't realize is night shift, they're staying up overnight, which is half the battle in itself. Having to stay alert and prepared for any event, at all hours of the night, and making the correct decisions for any critical thing that comes up is challenging. So keeping people doing a bunch of busy work is actually counterproductive, because while you have people scrubbing the floors or doing something that's irrelevant, that'll take you away from being ready for a call to an emergency. And let's say an emergency happens and you're cleaning the floor and some back tunnel of the hospital, when the code or something emergent happens on the other side of the hospital, and you show up late because you're cleaning, and the patient dies because it was delay of care because you didn't show up in time, I mean, it defeats the purpose. So this guy was all about that kind of stuff, and he ended up, his demise was, he actually was working at another hospital, and he got arrested for sexual assault at a different hospital that he was working part-time. And this guy was married. He actually was an avid AA person. That's why I really dislike AA. So it's just crazy how all of these reports just fall on deaf ears when it's the management, the corporate people, they just like the person, so they disregard the whole world, and they allow this type of person to stay in their position. And when I was looking deeper into it, the managers above him, actually, they barely even had associate's degrees. And they were they weren't even the specialty that our department was. It was a completely different specialty. It wasn't even nursing. I think it was pharmacy that they were, that they had like pharmacy tech degrees. And somehow they weaseled their way into a whole different department to not only be the manager, they were above the manager position. So you have lead, supervisor, manager. They were like the director of operations, all right? And they had an associate's degree in pharmacy, which is incredible. So the corruption goes all the way up the ladder, and then you start to realize why these departments, why these hospitals are ran so bad and they're so toxic, is because everybody in them is toxic. They're all a part of the toxicity. And so once I started to find that out, I started to realize that a lot of my efforts were worthless, okay? And I slowly started to look for new jobs, and there was a big couple incidents that happened that I'll talk about in another video. But you know, this goes to show that just because you're in a healthcare profession and it's a professional organization doesn't mean it's professional at all. This is one of the most disgusting places for an employee and for patients to be a part of. And I fought tooth and nail for what's right, but it turned into this, oh, he's from this place, he thinks he's better than everybody, you know, when, you know, I'm just trying to help, do my part, speak up for the patients, you know, as they're sitting in the break room just talking about how everybody should just die, how it's just a waste of time that we put all this work into this patient, you know, they're gonna die anyways. You know, that was the norm in the break room, which to me was disgusting. It's none of our business why a patient wants to stay alive. You know, that's their call. If they want to, you know, keep going and live, and they don't have their will, you know, if they're not DNR, DNI, then it is none of our business. We are not to push them about if they should live or die, and we're just there to follow the rules, okay, and do our job. But so many people, especially these women in healthcare, have zero integrity, zero empathy for patients' lives. It's disgusting. So I'll have some more videos about this topic. I just wanted to get a video out there about kind of this rough topic, but just go ahead and if you like the video, please hit the like button. If you got any stories that are similar, please drop them in the comment section, and don't forget to subscribe for more of these videos.